Hi, I'm Jennifer Turner, Chief Education Officer at California Home Care Registry. In this section, home care aides will learn the basics of some common medical emergencies. This section does not cover first aid procedures such as minor wounds and fractures. Instead, its focus is to emphasize those situations which can be life-threatening. This section is not a substitute for formal first aid and CPR courses. Instead, its purpose is to give home care aides an overview of the basics of care for some of the most common medical emergencies. This will enable you to recognize emergency situations and initiate prompt action to ensure the victims receive the care they require. It will also serve as a guide in knowing when and what to do when contacting emergency services. When you complete this module, you should be able to describe 3 basics of first aid care and 3 main goals in giving first aid. Describe and demonstrate general rules of emergency care. Recognize the ABCs of assessing a person's condition. Explain airway obstruction and what to do to relieve choking in an adult. Describe scenarios in which you would need to contact emergency services. Emergency care is assistance given to people who have developed severe life-threatening conditions which require immediate attention. It provides temporary assistance or treatment until medical help is available. The basics of first aid are to keep the injured or ill individual alive, prevent the injury or condition from worsening, and promote recovery. There are 3 main goals in giving first aid. They are to maintain breathing, stop bleeding, and prevent shock. While each case is individual and unique, there are some general rules which home care aides can apply to any emergency situation. Know the limits of your knowledge and abilities. Remain calm and focused. Don't move the victim or change their body position until you can get a better understanding of the problem unless they are in immediate danger. For example, there is a fire or the person is underwater. Check for breathing, bleeding, and pulse. We will discuss this later on in the video. If it appears the victim may inhale blood, vomit, or water into their lungs, position them on their side. If the substance gets into their lungs, they may choke. If the victim has an injury, try not to let them see the injury. Do not touch open wounds or burns without sterile bandages unless it's necessary to stop severe bleeding. Protect them from shock by covering them with something warm like a blanket or a coat, whatever is handy. Keep them warm enough to maintain normal body temperature, and always reassure them that help is on the way. When an emergency situation develops, the first thing that should be done is a quick assessment of the person's condition. This involves checking the status of certain body parts in a certain order. Here are the ABCs of first aid. A is for airway. Determine if the individual can breathe. If conscious, ask if they can breathe and evaluate how well they respond. If unconscious, tilt the head back by pushing the forehead backwards and lifting up the chin. This is called a head tilt chin lift. If there is anything in the mouth which may be obstructing breathing, remove it only if you can visibly see it and remove it safely. B is for breathing. Home care aides should be alert for signs of breathing distress and be able to determine if there is no breathing at all or if the breathing function is being affected. If breathing is present but not effective, breaths may be slow and shallow or fast and shallow. The individual may be gasping for air. The skin or lips may have a bluish tinge. The individual becomes more tired, or they may be sweating and lose consciousness. If breathing has stopped altogether, then the chest does not rise and fall, or breath cannot be felt or heard. Artificial respiration is the process of supplying air into the lungs of an individual who is not breathing. When they are not breathing, they need to be resuscitated. The methods of resuscitation are mouth to mouth and mouth to nose. C is for circulation. Check the entire body by feeling the head, neck, shoulders, arms, hands, chest, back, abdomen, pelvis, legs, and feet. Be alert for signs of pain or bleeding. If there's profound bleeding, hold firm pressure to control it. If they are unresponsive, shout for help or call 911, then check for a pulse. You feel for a carotid pulse by placing 2 fingers in the groove of the neck between the windpipe and the muscle at the side of the neck.
Let's review the ABCs of first aid. A. Airway. Determine if the individual can breathe. B. Breathing. Determine if there is no breathing. C. Circulation. Ensure that there is effective circulation.
Cardiopulmonary resuscitation, or CPR as we know it, is a combination of artificial respirations and artificial circulation. Artificial respiration delivers oxygen to the lungs, while artificial circulation pumps blood throughout the body. The goal of emergency CPR is to keep blood circulating to the brain and other parts of the body until the pulse returns or until medical help can take over. When a client appears to be in distress, you should first determine if the client is responsive by shout, asking them if they're okay. Tap or shake them on the shoulder or the chest. If there is no response, call 911 or other emergency services for help. Check for breathing and pulse and determine if the client needs CPR. If the pulse and breathing are absent, begin CPR if you have been trained to do so. Only perform CPR if the individual is unconscious and is not breathing. The importance of home care aides to take a CPR course cannot be stressed enough. The information provided in this section is theoretical information only. Practical training is also required to obtain certification. The information provided here is intended as an introduction to CPR and not as a formal tool.
Let's review CPR, cardiopulmonary resuscitation. Cardiopulmonary resuscitation is a combination of artificial respiration and artificial circulation. Artificial respiration delivers oxygen to the lungs, while artificial circulation pumps blood throughout the body. When a client appears to be in distress, you should first determine if the client is responsive by shout, asking them if they are okay, tap or shake them on the shoulder or chest. If there is no response, call 911 or other emergency service for medical help. Check for breathing and a pulse, and determine if the client needs CPR. Only perform CPR if the individual is unconscious and is not breathing and there is no pulse. The importance for home care aides to take a CPR course cannot be stressed enough. The information provided in this section is theoretical information only. Practical training is also required to obtain certification. The information provided here is intended as an introduction to CPR and not a formal training tool.
Home care aides may have a client who chokes. Therefore, it's important for them to know what to do as action has to be taken immediately. The following procedure explains how you might help a choking client. First, ask the individual if they're choking. Determine if they can speak or cough. If they cannot, shout for help and begin performing the Heimlich maneuver, which is a procedure using thrust to the abdomen to dislodge an item from the airway. Let's go over that procedure now. Stand behind the person choking. Wrap your arms around the individual's waist. Make a fist with one hand and place the thumb against the abdomen, just above the navel. Grasp the fist with the other hand. Press fist and other hand into the abdomen. Thrust upward with a swift and forceful motion. Repeat the procedure until the item is expelled or the choking individual becomes unconscious. And if you haven't already, call 911. Let's review this important procedure with some visuals for you to see how it is done. Stand behind the person choking. Wrap your arms around the individual's waist. Make a fist with one hand and place the thumb against the abdomen, just above the navel. Grasp the fist with the other hand. Press fist and other hand into the abdomen. Thrust upward with a swift and forceful motion. Repeat the procedure until the item is expelled or the choking individual becomes unconscious. And if you haven't already, call 911. Due to emergency, non-emergency, and other situations, home care aides and other agency personnel should follow specific procedures when clients do not answer their door. If the client does not answer the door and the door is unlocked, the home care aide should follow these guidelines. Enter the client's home, calling out the client's name. If the client does not respond, check the house and yard to determine if they are there. If the client is not at home, leave and close the door behind you. Check with the neighbors to determine if they have any information regarding the client's whereabouts and then advise the supervisor that the client is not home and provide the reason for his or her absence, or the client is not at home for an unknown reason. If the client does not answer the door and the home care aide cannot gain access to the client's home, then the aide should look through the letterbox, windows, side and back of the house, and basement to determine if the client can be seen. If the client cannot be seen, check with the neighbors to determine if they have any information regarding the client's whereabouts or if they have a key to the house. If the neighbors do not have any information regarding the client's whereabouts or do not have a key, telephone the supervisor for further instructions. If the home care aide can see the client lying on the floor and can determine that the client is not responding, the home care aide should call 911 following procedures outlined in the agency's policy on client emergencies. Call the supervisor to report the incident and await further instructions. Stay at the client's home until help arrives and ensure the house is secure when leaving. If the home care aide finds the client apparently deceased, the home care aide shall call 911. Call supervisor, the manager, or the administrator and await further instructions. Remain at the client's home until assistance arrives. Do not touch anything at the client's home. Ensure the house is secure when leaving and complete the agency's incident report. Unstable health is a condition wherein, at any time, an individual may experience deteriorating biological or physical changes or lose emotional control. If the onset of a client's unstable health condition is of an urgent or emergency nature, the home care aide should call 911 in accordance with the agency's client emergency policy. If the home care aide notices or suspects that a client's mental or physical condition is changing, they should note the signs, symptoms, date, and time in the client's file, and advise the agency's supervisor as soon as possible. Medication includes medicines prescribed for the client by a doctor or health professional and medicines purchased over the counter. These medicines include capsules, eardrops, eye drops, inhalants, liquids, lotions and creams, nose drops, patches, powder, tablets, wafers, suppositories, oxygen, nebulizers, creams by applicator, sprays, and insulin. A medication error or incident is a mistake that occurs in the management of medication and includes, but may not be limited to, the following: the medication given was wrong, the medication dosage was wrong, the medicine was given at the wrong time, the medication was given without an order, the medication was administered by the wrong method, the medication has expired, the medication could not be found, the medication was not stored properly, the medication was refused by the client, and the medication given was meant for another person. When clients administer their own medications, home care aides should check with the clients to ensure that they have taken their medication and then initialize the correct slot on the medication administration record. Make notations on the medication administration record when clients refuse to take their medication, clients take the wrong medication, clients take insufficient or too many tablets, clients are out of their medications, and if there are reasons why the medication was not taken. Advise the supervisor whenever clients have not taken their medication as prescribed. Observe the client for changes in behavior or well-being as a result of the medication incident and report such signs and symptoms to the supervisor. Document the medication incident in the client's record. If required to do so by your employer, complete an incident report medications form and give it to the supervisor. Provide reassurance to the client and remain with the client until the emergency response personnel arrive, unless advised differently by your supervisor. Home care agencies, staff, and other healthcare professionals should work together to reduce the risks and incidents associated with medication usage. Your agency is committed to ensuring the safety of its clients, their families, and employees when a suicide situation arises by handling the situation with composure, effectiveness, and speed. Every effort to prevent and minimize suicide attempts should be made. If an individual is threatening to commit suicide, if possible, remove means such as weapons, pills, ropes, etc. Be supportive and show interest. Speak openly and directly about the suicide threat. Be sympathetic, non-judgmental, patient, and calm. Listen to what he or she is saying. Allow him or her to express his or her feelings. Acknowledge and accept his or her feelings. Don't categorize individuals' feelings as being right or wrong. Don't make the person feel that he or she has to justify their suicidal feelings. Don't debate whether suicide is acceptable or not. Don't preach about the value of life. Don't argue or give advice. Don't try to solve his or her problems. Don't dare the individual to follow through on their threat of suicide. Don't act surprised. Don't promise to keep the suicide threat confidential. Advise him or her that options other than suicide are available. Seek help. For example, contact a crisis intervention person or agency, or a suicide prevention person or individual. If an individual has attempted suicide or appears to have attempted suicide, dial 911. Make sure the person is not left alone. Do not leave the person unattended until the emergency response team arrives. As an employee of the agency, you are responsible for reporting to the supervisor and/or management all suicide situations they observe, calling the emergency number if they believe or feel there is an immediate danger to someone's safety, and following the agency's policy guidelines. Anytime there is an incident, the situation shall be documented, providing as many details as possible. In a medical emergency, every second counts. Here are some examples of symptoms that constitute a medical emergency. Call 911 right away if your client or a family member experiences any of them. Doing so could save a life. Chest pain that radiates from the shoulders and arms, accompanied by nausea, vomiting, fainting, or sweating. These are classic signs of a heart attack. Sudden numbness on one side of the face or limbs, confusion, slurring of speech, vision loss, severe headache or dizziness. These are all signs of a possible stroke. FAST is also an easy way to remember the sudden signs of a stroke. When you can spot the signs, you'll know that you need to call 911 immediately for help. FAST is an acronym that stands for F. Face drooping. A. Arm weakness. S. Speech difficulty. T. Time to call 911. Face drooping. Does one side of the face droop, or is it numb? Ask the client to smile. Is the client's smile uneven? Arm weakness. Is one arm weak or numb? Ask your client to raise both arms. Does one arm drift downward? Speech difficulty. Is the speech slurred? Is the client unable to speak or hard to understand? Ask the client to repeat a simple sentence like, "The sky is blue." Is the sentence repeated correctly? If these symptoms occur, it is time to call 911. Head, neck, or back trauma, difficulty breathing or shortness of breath, severe uncontrollable bleeding, abdominal injuries or sudden severe abdominal pain, coughing or vomiting blood, fainting, dizziness, or hallucinations. If a client has fallen and has pain or the appearance of a broken bone. If a client is non-responsive, falls and cannot get up on their own with or without assistance. Severe allergic reactions from medications, insect bites, food, or beverages. An overdose of drugs or alcohol. Poisoning, and attempted suicide or suicidal threats or statements. If your client experiences any of these or any unusual symptoms, immediately do the following. First, call 911. Call your supervisor or your agency, and wait for further instructions.
(911) for what city?
Calling for help is easy. Dial 911 and the information you give the emergency dispatch operator helps emergency medical services help you. When you call 911, describe the emergency. Speak slowly and clearly. Give your name and phone number of where you're calling. Give the exact location and address of where you are. Give the name and the age of the person needing help. Follow the dispatcher's instructions and answer all of her questions. Don't hang up until you're told to do so, and don't leave the scene until help arrives. Always remember, in the event of an emergency, call 911. Stay calm and help keep your injured or ill client calm. Keep the client awake and warm. Remember, do not move them unless instructed to do so, and wait for help to arrive. The death of a client while on the job can be an especially challenging experience for a home care aide. It is important to know and comply with state and community regulations related to deaths occurring in the home and to follow your agency's policies and procedures when a client dies at home, either expectedly or unexpectedly. An advance directive is written instruction which is recognized under state law relating to the provision of health care when an individual is incapacitated. Examples of types of advance directives include do not resuscitate or DNR orders, living wills, and a POLST, which is a physician's order for life-sustaining treatment. A do not resuscitate order is an individual's request not to have cardiopulmonary resuscitation, CPR, or other measures conducted in the event that his or her heart stops beating and or he or she ceases to breathe. DNR orders are accepted by doctors and hospitals in all states. A living will tells how a person feels about medical care intended to sustain life. He or she can accept or refuse care. Living wills address many issues such as resuscitation, dialysis, tube feeding, organ donation, and respirators. The POLST form, or a physician's order for life-sustaining treatment, is a set of medical orders similar to the do not resuscitate, allow natural death order. A POLST is not an advance directive. A POLST does not substitute for naming a healthcare agent or durable power of attorney for healthcare. The POLST form is for seriously ill or frail patients for whom their physicians would not be surprised if they died in the next year, not for all patients. A POLST is not for everyone. Let's review the procedures for you to follow when you are working at the home, the client dies, and there is no DNR order. Unless the client is admitted to hospice services, you should first call 911 and start CPR, if it's within your agency's policy and you're trained to do so. Remember to unlock the front door. You may be asked to assist the Emergency Medical Service, EMS, responders. Just follow their direction. Contact the client's physician. Contact the agency's supervisor to advise him or her and remind them to notify other home care aides. Unless your supervisor instructs you to leave the home, you will want to remain to assist the family, as required or requested, with follow-up measures such as notifying other family members or friends, contacting the funeral home, contacting priest, rabbi, pastor, or other religious personnel, and any other activities requested of you. It is important that you document the following in the client's record: the events surrounding the death, the date and time of death, the identity of those present, and actions taken by others and agency staff. Let's review the procedures for you to follow when you are at home and the client dies and there is a DNR order. When the client dies at home and there is a DNR order in place, you will follow the same procedures as before, only without doing CPR. When the client's death occurs unexpectedly while you are in the home, you will need to call 911. Again, unlock the front door. If the deceased wishes regarding DNR are not known, begin CPR immediately and continue until instructed to stop by the EMS operator. If the deceased has a DNR order and the documents are on the premises, direct a family member or other person to retrieve the document to have it in hand for EMS, or if no other person is present and the location of the DNR document is known, retrieve them to have ready for EMS. Be prepared for possible questioning by the police. If the unexpected death has been sudden, uncertain, or as a result of injury, avoid disrupting the environment around the deceased, as the police may call in the coroner. If a hospice aide is not in the home at the time of death, contact hospice. A hospice nurse will come to the home and pronounce the death, may arrange for pickup of the body by a funeral home, and may assist the family with other post-death activities. EMS is not usually contacted when hospice is involved. As the home care aide, you should assist hospice nurse and family as requested, with follow-up measures such as notifying other family members and friends, contacting religious personnel, and other tasks which do not fall outside a home care aide's allowable duties. You must contact your agency's supervisor to notify him or her of the death and remind them to notify other home care aides scheduled to work in the home. And as always, you will document in the client's record the event surrounding the death, the date and time of death, the identity of those present, and actions taken by others and agency staff.
Emergency care involves providing assistance to injured or suddenly ill individuals using whatever materials are available until medical help can be obtained. Its purpose is to preserve life, to prevent the condition or injury from becoming worse, and to promote recovery. This is accomplished by maintaining breathing, stopping bleeding, and preventing shock. Emergency care involves both knowledge and skills, which may be obtained by taking a formal first aid course, such as the American Heart Association Heart Saver, First Aid, CPR, and AED training.
Let's review the basics of first aid. The 3 basics of first aid for you to remember are: keep the injured or ill individual alive, prevent the injury or condition from worsening, and promote recovery. Let's review the 3 main goals of giving first aid. They are to maintain the client breathing, stop the client from bleeding, prevent the client from going into shock. Now, let's review some of the general rules that you should follow when providing emergency care to your client. First, know the limits of your knowledge and abilities. Remain calm and focused. Do not move the victim or change their body position until you can get a better understanding of the problem, unless they are in immediate danger. Check the client to make sure they are breathing, not bleeding, and that they have a pulse. If it appears the client may inhale their own blood or vomit, then position them on their side. If the client has an injury, try not to let them see the injury. Do not touch open wounds or burns without sterile bandages unless it's necessary to stop severe bleeding. Protect them from shock by covering them with something warm, such as a blanket or a coat, whatever is handy. Keep them warm enough to maintain body temperature. Reassure them that help is on the way.
Okay, it's time for a quiz.